Welcome, everyone. On behalf of the Ogden Surgical and Medical Society, I'd like to welcome Dr. Matt Wilson to share an update of the 2021 Utah State Legislative Session from the perspective of the Utah Medical Association. So welcome, Matt.
Thank you. I'm glad to be here.
Yeah, you bet. Dr. Wilson is a board-certified OBGYN with Granger Medical Clinic in Riverton, where he holds multiple leadership roles at the Intermountain Riverton Hospital. He also serves on the academic faculty of the University of Utah School of Medicine. Most significantly for today's discussion, he is the immediate past president of Utah Medical Association. Educational journey has gone from BYU to Penn State for medical school and residency training in Phoenix, Arizona. Which you like kind of most, Matt? Provo, Penn State, or Phoenix? Which was your favorite?
They're all great places to be. I grew up in the West, obviously, and going to the East Coast is a different experience, different kind of culture, different kind of standards as far as interpersonal interactions when you are out in public. Wonderful people, wonderful place. But when we came back West for residency, it felt more like home again. Phoenix is a beautiful area. I think it's maybe the prettiest place I've ever lived. I know it's funny to say, we were like, oh, how could you say that desert is beautiful? But everything is so well manicured, and the colors at sunset really pop. I love it, but I love being in Utah. Obviously, this is my home.
Yeah, well, with no grass, you can't really mess it up as far as the landscape, so it works out pretty good.
It does make for some lower maintenance yards. That is true.
Well, I loved your interest outside of medicine, from reading to skiing, but I was most intrigued about your involvement in the International Rhino Foundation and your adoption of Rosa the rhino. So how does one go about knowing which rhino is the right one for them to adopt? What are you looking for when you're bringing a rhino into your family?
Obviously I'm not in leadership there. I'm just a low-level member of the International Rhino Foundation, just supporting their conservation efforts. I'm a realistic conservationist is what I like to call myself, but I've always been fascinated by the rhinos. They're strong, powerful, often underestimated in a lot of their characteristics, don't have any natural predators, and are in great danger of extinction. There are 5 species of rhino in the world. The one that I adopted is a Sumatran rhino. Sumatrans are the smallest of the rhino species, although still quite large. And so since my yard isn't very big, we decided to go for the smallest species of rhino. No, I'm joking, of course. Adoption, of course, is only formality or ceremonial. I don't know what word you want to apply there, but obviously, I'm just a sponsor for her upkeep in Indonesia. The reason to choose Sumatran is because they're the most endangered. Their native habitat is in Southeast Asia and Indonesia. They're very solitary animals and don't actually thrive in captivity. The ones you usually see in zoos, like Utah's Hogle Zoo or white rhinos, they do quite well in captivity, breed quite well in captivity, and that's one of the many reasons why they're the most commonly found in zoos. And they're from Africa. The Sumatran rhinos are in great danger because of poaching, and so that's why I chose Rosa. Sorry if that was more information than you wanted.
No, but I guess the key question, though, have you ever tried to have Rosa as a comfort animal on an airplane flight?
Yes, I do that regularly. I'm hoping, Jason, you'll write me a doctor's note for that today.
I'd be happy to for your comfort travel animal. So well, let's jump into it, Matt. And so give us a quick overview of the UMA and what it does for the physicians in Utah and why every physician should be involved.
Well, Utah Medical Association has been around for a long time. We just celebrated our 125th anniversary as an organization, and has been well respected by physicians, other healthcare professionals, legislators, and other stakeholders for many, many years, long before I got involved, of course. UMA is an advocacy organization. So what does that mean? We advocate, we speak out on behalf of physicians and patients. I would estimate that at least half of the advocacy work we do is purely for patients, trying to make sure patients stay educated. And by patients, I mean anybody, any member of the population, because everybody needs healthcare at some point. Helping them quality access to healthcare, helping them not get taken advantage of by anybody who might do that, whether that would be unethical insurance practices or legislators who don't understand medicine, et cetera. But our advocacy work ranges from press events to lobbying to working with legislators or members of the state or other governments to help meet the needs of the physicians and the people of Utah. It's really important work we do. We as physicians, we tend to be, I think, we have an overrepresentation of control freaks probably. And so it makes sense. Those of us, we like to be in control of our lives, of our futures, of our outcome. And of course, we like to micromanage things for our patients, help them get the best outcome. But if we neglect the public policy, the work that government agencies are doing, legislators are doing, et cetera, if we neglect that, then we relinquish that control to somebody else. So I think that it's pretty hard to learn about UMA and not want to be involved.
How does the UMA decide what position to take on certain issues? How is that formulated?
It's really cool. I actually really love how UMA does this. The main policy decisions or main positions that UMA takes is decided by a very representative, kind of a Democratic Republican type style that we use. Every year we have a big meeting. It's called the House of Delegates, where every healthcare organization, every specialty society, every county medical society gets representation. And all those representatives meet up, and they're called delegates, of course. Every delegate is equal. They all get an equal vote. Any delegate can put forth resolutions. For example, I think that we should take, you might think that the UMA should take a certain position on out-of-network billing for insurance. I'm just giving that as a random example. So then it gets debated in the House of Delegates through a process not too dissimilar from how our legislative body works in the state and then on national level. There's a committee that debates it, and then it goes on to the House for further debate and finally either adoption or rejection. Every member of the Utah Medical Association is hypothetically represented in choosing our position or what side we're going to take on kind of hot button issues. And of course, it's too cumbersome to get all the delegates together on a day-to-day basis. So the delegates also elect a board of directors. There are many positions on that, including 3 presidents. And that board of directors is entrusted by the House to handle day-to-day decisions. For example, governor comes out with a statement, and UMA needs a response to that, whether we support it or want to speak against it, whatever have you. And that's where the board of directors comes in. But we always, of course, stick to anything that has been passed by the House of Delegates and apply that as we go forward.
How does that actually happen, Matt? Once you have a resolution passed and the UMA takes a position, how do they actually influence and affect change for physicians and patients in Utah?
Of course, it depends on what the position is or what the issue is. Sometimes that means introducing legislation. Of course, the UMA does not have the ability to propose laws, but we have a lot of friends and allies in the legislature, some of whom are doctors and others are just informed or good listeners. And so we work with those, introduce legislation. We then help provide that legislator with all the information and tools that they need to put that piece of legislation forward. We might even go and speak to some of the other members of the committee to which the bill is assigned, help them understand why we're doing this. We'll obviously testify in committee, both on the House and the Senate side, and try to get that legislation through. But sometimes it's not so proactive. Sometimes it's more reactive. Sometimes we don't want to see something go forward. And so if there's a piece of legislation that is against one of our adopted policies, then we would, of course, speak against it and work with our colleagues in the House and the Senate and testify in committee, do the work of advocacy, basically, and try to get either the bill defeated or get it amended so that it is not doing any harm to our patients or public or to the physicians of the Utah.
And on occasion, you'll hear about these calls to action where physicians in general are being asked to raise their voice and support things. And have those been helpful in the legislative sessions?
I'm glad you brought that up, Jason. Those are really important. I hope that all of the people that are listening, well, I hope everyone who's listening is a UMA member, of course. If you are, you'll get occasionally, we don't abuse this, somewhere between 1 and maybe 5 times during the state legislative session, you'll get an email saying call to action. That's arguably the most important email to read from UMA. There are others you might get occasionally, but that's probably the most important one. It doesn't take long to respond to one of those calls to action. You can do it in under 120 seconds probably, but it does make a big difference. Do you realize that our state legislators are not full-time politicians? Every single one of them is a part-time politician, and they have about 6 weeks to learn about, hear about, amend, and vote up or down on hundreds of bills every year. They can't possibly become experts on all of those topics, on every single bill that comes up. So hearing from their constituents is a big deal. As I've spoken with legislators, they take it seriously. When you email somebody and say, hey, I'm Dr. So-and-so, I'm a constituent, there's an issue with House Bill 201, I'm just saying something at random, here's my concern with it, or here's why you should support it, whatever UMA is asking you to do. You don't have to write a long email or go out and camp out by his house or anything like that, but they'll take it seriously. And if they hear from a number of constituents one way or the other, it'll really make a difference for them. Sometimes it means they will reach out to Michelle or the president of UMA and ask for further clarity, and how can we make this better, for example, might be a result, a really positive result that we'll see from a call to action.
Thank you for including us as one-by-one members and helping to affect real change at the grassroots level. So we appreciate you as leadership and including us. So thanks, Matt. What were some of the legislative issues and bills in 2021 that have the greatest impact on our fellow physicians?
Healthcare is a really big part of our state and national economy. As I mentioned earlier, every single person is a patient at some point. Politicians are under a lot of pressure to try to make healthcare as good as possible. Of course, we know that they like to politicize issues that are not political, or that shouldn't be political, and maybe should stay out of certain areas. But generally speaking, they're well-intentioned, trying to make things as good as possible. There are quite a few that I think that were passed this year that could affect the day-to-day practice of our physicians. Right off the top, I'll mention there was a bill about controlled substances. Opioid abuse and overuse, overdose, et cetera, are a really big issue nationally and in the state of Utah. We rank above average in our opioid use and misuse as a state compared to other states in the nation. As long as I've been participating, there have been bills on this subject every single year. Representative Ray Ward and Senator Mike Kennedy are both physicians. They're good doctors and good people. I know and respect both of them, and they introduced a bill this year to make changes to the requirements on controlled substance prescribing. I hope that this isn't the first your audience is hearing of some of the changes that they've been making over the last few years, some of the requirements. Did you know that it's state law that you are to check the controlled substance database every time you write a prescription for a controlled substance, especially acute? A lot of people think, well, surely not for my surgical patients that just need a 3-day supply or whatever. It's actually especially those people. The people that are using long-term opioids, you don't have to necessarily check it every single time, but there is a frequency, and I believe it's every 30 days that physicians are to check it. And so the last version, so I'll get finally to answer your question, what's important about this bill. The last version of this legislation said that your maximum supply could be 7-day supply. There used to be an exemption that you could write longer than a 7-day supply if the patient was a surgical patient, and now that's no longer the case. So now 7 days is the maximum supply you can give to a patient in any situation. That's probably not a big deal for somebody who did ear tubes on a little child. They're probably not writing longer than a 7-day supply of opioids, but maybe a cardiothoracic surgeon might sometimes write longer supplies, so they'll have to come up with a workflow to stay compliant with that law. So I think that's a relatively important one.
Hopefully it can make a big difference in our status in the opioid overuse in Utah. That's great.
We're trying to all buy in here. We need physicians to buy in on the problem. I know that getting myself educated on this subject has really helped me a lot. I've definitely decreased my prescribing by more than 50% just in the last 4 years as I've learned more and more about this subject. I don't know if this is helpful for this setting, but I've really shortened my supplies and my durations, and then I've created workflows where if patients need an additional 3 days, I get it for them, including occasionally writing a future dated prescription, which of course a number of years ago was passed to make us physicians allowed to do that, to write a future prescription. And studies have shown that that most of the time those will never get filled. And so that means fewer opioid medications floating around people's homes and that sort of thing.
That's a great one to both help both physicians and their patients as well. It's a great piece of legislation.
Well, it's a good segue into another topic that we see often, including this year, which is suicide prevention. And unfortunately, opioids are often a factor in a lot of suicides. Obviously not the only factor. Opioid overdose is one of the highest causes of maternal mortality. So I'm an OBGYN, as you mentioned, and so I pay extra close attention to maternal mortality, and our state maternal mortality review committee year after year drawn the conclusion that opioid overdose is basically the number one threat to keeping women alive after birth, after giving birth. Some cases may be accidental, probably most are intentional. And we'll see most years legislation on this topic. Representative Steve Eliason is a good man. I respect him a lot as well. Not a physician this time, but you'll pretty much always see him putting forth legislation on this subject. This year, there was a bill on this subject that directed the Division of Substance Abuse and Mental Health to create a program to help rural healthcare providers and smaller health systems implement a zero suicide program that involves targeted screening and referral to resources. This is a program that has been successfully used at Intermountain University already. And so we basically were able to expand this on a state level. UMA was a strong supporter of this legislation, and pleased to say that it did pass. There are other bills on the subject of suicide, for example, further help in making mental health records confidential and making sure that people feel like they can access mental health resources and behavior therapy, that sort of thing, with good confidentiality. That would be something that I think is applicable to both physicians and patients as a kind of important pieces of legislation as it relates to healthcare. You may be alarmed to hear that physicians commit suicide at a rate much higher than the general population. We need to keep an eye out for our colleagues, and of course, other healthcare professionals are included in that statement of colleagues.
I know it's helped me a lot to make screening a high priority for mental health, to make sure that I'm inviting those questions of my patients, appropriate times, to make sure I'm allowing them to let me know how they're doing. They don't always appear to be doing badly on the outside, and so asking those questions and screenings has been so critical to helping out to delivering good mental health to patients. So good legislation.
Mental health is very important. We always have room for improvement in terms of public policy and individual practices. I don't think any physician can neglect it. I guess maybe a pathologist can neglect it a little bit on a professional level, but of course not on a personal level.
One thing that comes to mind for me is, impacting, our practices is our work with our advanced practice practitioners in our offices. What are some of the changes involving the APPs in Utah? So
the biggest change as it relates to APPs would be the pathway that physician assistants or PAs have to independent practice now. They did not have that pathway until this year. UMA has never been opposed to that in principle, but it was quite a lot of work on a board level and as president over those last couple of years to make sure we could do it in the right way. Obviously, if a PA is going to be practicing independently, we want them to have demonstrated competence. The training that they get is good. I've worked with a lot of PA students over the years in individual precepting, and I'm frequently quite impressed by the quality of their education that they have. It is not the same duration and the same exposure that a physician gets. By the time any physician finishes residency, they've spent at least 2 times, probably more like 3 to 4 times, the amount of hours caring direct patient care than compared to what a PA does coming out of their training. So it was a lot of work to make sure we could design a program right that would give the PAs a chance to demonstrate their competency, get enough exposure, and then give them the chance that once they are practicing, maybe in a given specialty or in a given set of condition for a given set of conditions, if they're practicing at a level of physician, why shouldn't they practice independently? That makes sense. Of course, these are the types of things that take a lot of work, and the PA group was really great to work with as well. Obviously, in this case, we weren't worried so much about protecting physicians. Like I mentioned earlier about how at least half of our work is for patients. While I would never, I'm not accusing that any PA misrepresents his or herself. A lot of people in the public just don't understand what the difference is, and so I don't think we could leave this up to just buyer beware kind of situation. Just say, okay, everybody can do whatever they want, and patients just watch out for yourselves. We got to watch out for them a little bit too, especially when we're creating public policy. We don't want to create unsafe policy.
I think it was wonderful to see the UMA involved in helping to make sure that the public was aware of a level of licensure and the quality of care they get from physicians here in Utah. We appreciate the work you did to help out with that, to make sure that patients are protected. And we love working with our APP colleagues as PAs and nurse practitioners, and we love the collegiality. And so thanks for all the work with that one too. When you have bills numbered in the 200s, there's a lot of action going on up on the Hill. What are any other bills that you felt were particularly meaningful for physicians, patients this session?
There's always legislation on insurance. We have a complicated healthcare system, if you want to call it that. Some people even accuse America of not even having a healthcare system. I'm not going to opine on that, but our ability to have choice and have physicians that practice independently is a great thing. But it comes with a level of complexity when it comes to paying for healthcare and insurance. So you're pretty much every year going to see insurance regulations and modifications to that. There's been a big issue over the last few years on the subject of what we call balance billing. It's been 3 straight years that I personally have attended dozens of hours of meetings on this subject. Michelle McComber, our CEO, is probably beating me by a ratio of 10 to 1 on hours spent on this subject. Balance billing is what a physician does if not just a physician, any healthcare provider, if you take care of a patient out of network for whatever reason, and the insurer or the payer reimburses the clinician what they consider their out of network rate, which usually is well below kind of the standard rate, the provider therefore bills the patient for the remainder. That's of course not ideal for the patient or the physician or the provider. No one's really excited about that situation. Everyone saw in-network providers, but when it's an emergency, you don't really get a choice, right? So patient shows up with a broken arm at the hospital and the orthopedic surgeon on call, it happens to be out of network. That's a bummer for patients, so they get stuck with that balance bill. So the concept of regulating this so that they don't have to, that the patient doesn't get stuck with a big out of network balance bill is a good concept. Definitely would love to see that. Of course, the best way to make that happen is to expand networks, which UMA has been fighting for and advocating for at great length for years. Almost always, when a provider is not in network with a given insurer, third-party payer, it's not because they didn't want to be in network. Almost always it's because the insurer has decided they want to have a small panel of physicians or providers in a given specialty for whatever their reasons are. So legislators have tried really hard, and they're working on it really hard on a federal and on a local level on this subject of trying to help patients not get big surprise bills. We've not been able to come to a compromise with legislators over the last 3 years, and it's to the credit of the UMA and the work we do, the fact that the legislators haven't just pushed something through. They want to make sure that it's something that makes sense, that actually works. The problem is, the reason why this matters is healthcare providers and patients can potentially be really harmed if a bill like that were to go through in the incorrect manner. And let me try to explain that. If the legislation simply were that physicians and providers cannot balance bill, they can only accept what the out-of-network rate is, then it would be to the insurance company's great advantage, great incentive to narrow their panel of physicians that are in network, because they would save a ton of money on payments for services for all these out-of-network services. And of course, that's no fun for patients either, because they're trying to find physicians that are in network. And if they can't find one, then they kind of get stuck too. The answer isn't simply ban balance billing, as we call it. And unfortunately, it's not quite as simple as just saying, well, just pay everyone the in-network rates, because those are all proprietary and confidential. And so basically what we keep working on is trying to figure out a way to aggregate or average the in-network rates and kind of get the insurers to pay that to the physician that provided the out-of-network service. And seems to make sense, but we have three parties involved: the legislators and the insurance company and the providers, and that's not always easy to kind of create that exactly as simply as it sounds. But in the meantime, we continue our work to try to expand networks and try to get more providers on panels, on insurance panels, including UMA actively meets with insurance companies like Blue Cross and Select Health, et cetera, to try to advocate for providers. It doesn't matter whether it's physician or advanced practice practitioner. Either way, we're advocating to try to get more providers in network.
I think hearing you share that really impresses me with two things. Number one, it's amazing how much the things we're working hard for both help physicians as well as their patients. And I think the second thing is realizing it's really how much the UMA does for every single physician in Utah, working in the background, working hard, even for every dollar that you make is something that UMA is working hard for each of us as physicians, that many don't even realize, how much work's being done on their behalf for advocacy. And I think the importance of being involved in the UMA because of the way it represents each of us one by one by one.
I agree 100%. It's okay if you don't want to be heavily involved and you're just a member. That's great. Be involved just as a member and maybe occasionally respond to a call to action. That would be great. But every member of UMA has the opportunity to be a delegate if they wanted to and attend the House of Delegates. It's actually a really fun meeting. It's really fun to meet your fellow UMA members or the other delegates at the meeting, and you learn a ton. My first 2 meetings I went to, I didn't say a word. I didn't testify. I didn't speak out. I just sat and listened, and I was so fascinated. You'd think that'd be the kind of meeting you'd fall asleep in. When I go to my educational conferences and stuff like that, sometimes I have to come up with tricks to keep myself awake, but I was riveted, even though I didn't have a thing to say. If you just kind of tune your radar into watching out for invitations to become a delegate, respond, between your county medical society, your specialty medical society, your group you work with, hospital you have privileges at. There's so many opportunities to become a delegate. I would recommend it for anybody. It's even if you don't think you're politically active, you don't have to be, and you definitely do not need to consider yourself partisan to participate. There is definitely no rule that we are friends with only the Democrats or the Republicans in UMA. We hate both equally. We work with both as much as we can.
I am amazed at the diversity of expression of ideas with the UMA. It's a wonderful group to be part of and seeing that it's not one-sided at all, but a very robust and dynamic set of discussions, and again, very collegial, which I wish we could see carry over to our politicians. But I think we manage ourselves very well. And as we move forward, a diverse group with the UMA, it's been wonderful.
Well, you've been talking to me as if you're not part of it as well, Jason, but our listeners today should, Jason's been a member of the board of directors for 3 years now. 3 years, yeah. And he's been really important member of the direction of the UMA. And we had a really strange, the last 13 months have been really strange and unlike anything we could have expected. So thank you for your help and your voice. You've been a great part of the team.
Oh, you're welcome. Yeah, those once a month meetings became, several hour a day meetings for weeks at a time, during the pandemic early on. So it's
those first 3 months, it felt like I couldn't go for 6 hours without hearing from at least one of you.
Well, that sounds great, Matt. I guess maybe the last 2 questions, or even if you feel like you've already covered these pretty well, but just, anything that you kind of gleaned personally from being so deeply involved with the legislative session.
Being involved with advocacy work in general has really taught me a lot about the political process and the value of the different voices. I think that people kind of think of lobby work or advocacy work as some sort of evil or shady business, but it's really important. There are going to be people speaking their minds, and whether it's just the politicians or other stakeholders, it might as well be us speaking up for ourselves and for others. It's definitely opened my eyes to the good work of our advocacy group and others. It's opened my eyes to the value of hearing both sides. I was much more tribal in my politics until I got involved and really saw how things work on a personal basis. If you find that the world is too divided and you can't possibly imagine the other side coming to your side, and that really depresses you, get involved, you might realize that, hey, the other side has something interesting to say too. This particular session I'll speak to as well. I want to thank and congratulate Governor Cox for his leadership in this last session. And he asked that the legislature not bring forth any really divisive legislation this year. And it was felt, again, as an OBGYN, seeing women's health being legislated in sometimes really heated ways every single year. It was nice to have a little bit less divisiveness on some of the really hot issues that weren't urgent. Sometimes things aren't urgent. And so we don't have to push those really divisive issues through. 2020 was a really rough year, not just the pandemic. The election and other sociopolitical issues throughout the nation really left a lot of hard feelings all around. And that was a nice change. And it couldn't have come at a better time, considering the fact that they were letting so few people into the Capitol. It was harder than ever to get your voice heard. We managed, we got it heard on every single issue that mattered, but it was harder than ever. So I want to thank him. I want to thank our legislators for their good work. They're not paid nearly enough. I know it's funny to hear me say that. They're paid very little, and they're given very little prestige or honor for their work, but they do really important work. Of course, I want to thank the UMA members, all the members, for your support, for responding to emails, to responding to surveys, to showing up at the House of Delegates, to speaking out and reaching out. Your voice matters, and I want to thank you for your participation.
Thanks, Matt. I agree in everything you said. I mean, we have a wonderful group of legislators that deserve our kindness and work so hard, and also deserve our support and input. And thank you and our CEO, Michelle McComber, and our current president, Sharon Richens, and just all the men and women physicians who function with the UMA, and they do everything. Is there any last words? I want to give you the last word on encouragement for people to be involved in affecting change.
It's easier than you think to make things different. If you think that the world is not going in the right direction, or our state or our country is not going in the right direction, it's not. It's actually quite accessible to make a difference. It truly is. Get involved with UMA. Get involved with other advocacy groups that represent something that's important to you. Get to know your legislator. It's not hard. They hold meetings. They usually respond to emails pretty quickly from constituents, your local legislators especially. It's really easy to get to know them. Donate to campaigns, to political action committees, that sort of thing, for something you believe in, especially on a local level. $100, $1,000, something, whatever makes sense to you can actually make a difference. If you're just going to scroll Facebook and complain, that can be cathartic, but you don't have to stop there. You can do any of the things that I just mentioned, and you can make a difference. For me, my passion is making a difference in healthcare advocacy. So I've seen it. I mean, I've been involved heavily with UMA since about 2012, and there are dozens of bills that either are passed or not passed or written the way that they are written because I spoke out. And I don't mean to brag. Anybody, that can be anybody. And I'm sure, Jason, you can say the same thing. Your voice matters and it's accessible. You can get it out there.
Well, thanks for your time, Dr. Wilson, and time away from your family and practice and Roast of the Rhino. And thank you for all you've given, and thank you for all your time in teaching us today.
Thank you. Good luck, everybody.
The producers for this podcast are Clark Madsen, MD, MS, Teresa Puskedra, MPC, and the Ogden Surgical Medical Society Board of Directors. The executive director is Teresa Puskedra, MPC. Your host for this episode was Jason Hoagland, MD. Editing and sound design is by Colton Gomez, and this is all supported by members of the Ogden Surgical Medical Society.